and we are super, super excited to debut our brand new segment as well with OrthoVirginia. They're a proud sponsor of our Talk of the Town stuff going around to high school games every Friday, highlighting student athletes every single Wednesday as well. And along with that, on Wednesdays, we'll be joined with OrthoVirginia doctors telling us everything that they've got going on. And today, the debut one, it's Dr. Justin Dumont, and he's joining us today to talk with pain management, all of that fun stuff. Dr. Dumont, thank you so much for taking some time out of your day to chat with us. Good morning. How you doing? That's awesome. I want to dive into it. Kind of love to chat because this is in the news right now. A lot of stuff going on with Matthew Stafford, with Micah Parsons. Two guys I know you don't necessarily work with, but they're going through some pain management of themselves. I think Stafford is having an epidural, right? And like that seems to be an insane jump. But I want to know, can you walk us through the process of dealing with pain like that, and how bad must it actually be for them to need epidurals?
Number two, right? So it's a pretty common condition, and oftentimes what ends up happening, if we look at acute injuries, you can have sometimes, I don't know the whole situation of what's going on with him, but what can happen is you can have sometimes some discs can be herniated and can be compressing nerves, and that can be very painful. And that can cause you to have, loss of mobility because your body's trying to protect itself in that acute phase. But then sometimes what happens is if a nerve is getting pressed on enough, it can cause symptoms, especially in your back, going all the way down your leg, which can limit your ability to do day-to-day tasks, tie your shoe, bend over, and let alone try to, complete a pass, 50 yards as well. And I can tell you it can be very painful. Fortunately, oftentimes when we look at acute injuries, things can get better with a period of time, but we look at an athlete and what ends up happening is their window to try to get better is a lot smaller than, folks like myself and some others that are not playing in the NFL. But it can be a horribly painful. To get better is a lot smaller than, folks like myself and some others that are not playing in the NFL. But it can be a horribly painful experience. I mean, I have patients tell me all the time, I'd rather have natural childbirth rather than have, acute back pain going down my leg called sciatica. So it's painful for sure.
So we hear the word epidural used a lot, like around football players. We also hear it with pregnancy a lot. Like that is what is used if people choose to use that. What is exactly an epidural? I've been lucky enough never to have one. So can you kind of explain to us what that is? Is it just a souped up painkiller?
No. So what the epidural space is, it is a space in the back part of the spine where medication can be safely deposited. So let's take the example of pregnancy, right? So in pregnancy, what ends up happening is there is a catheter that may be placed in, and medication is delivered kind of continuously to help to continue to block those nerves during that period of time. When we look at an epidural from the standpoint of a back injection as, say, an outpatient, it's a little bit different in that we're not placing a catheter. However, we are accessing this space. It is a space that is in the back part of the spine. It's not in the spinal cord or in the spinal nerves itself. It's in this area that's kind of in the back part, and it covers that area. So it gives us an avenue to deliver medication close to where those nerves are to try to help with delivering some medications that can help with some of the pain that they may having. The key is oftentimes there's sometimes different types of medications used, so in an epidural for pregnancy, it's oftentimes, there's like a lidocaine type medication that's delivered like a medicine that helps with that. But in the outpatient setting, typically when we're treating back pain going down the legs, oftentimes we're using a steroid, and that steroid, what that does is when there's say a disc or something that's pushing up against the nerve, causing acute pain. That can be painful, and there's an inflammatory process that occurs. So the steroid itself, we deliver it near that area to try to help reduce some of the inflammation and irritation that's occurring because of, let's say, the disc pushing on the nerve. So it's a strategy to help address that acute pain.
Okay, that makes a lot of sense. Another player that I know you guys aren't working with, but it was in the headlines a lot last year, right, was Christian McCaffrey dealing with this tendonitis, his calf tendonitis. How do you deal with that type of pain, that type of pain management? Because, I mean, I was in marching band, and I know my marching band tendonitis with my shoulders, nothing what happened with Christian McCaffrey back in high school. But that is something that you kind of have to manage through and deal with the pain, because it's not something you can get rid of totally, I feel like. Correct me if I'm wrong. You are literally the doctor in this scenario.
Sure. So if we look at pain and we look at what can cause pain, there are numerous types of sources of pain, right? So we were talking a little bit about neuropathic or nerve pain, right? But there can also be pain like nociceptive, meaning from tissue, muscle, tendons, ligaments, and a variety of things can cause pain. Pain is a normal response in our body, right? Like our body, we use pain as a way to help us to modify things that we're doing and help us to understand what's happening within our body. So it's not something that, I think, we oftentimes hear about pain and we go, oh, it's horrible, but it is a natural process. Our body, we rely on that so that we can modify and change things and we can prevent injury. So when we look at ligamentous or tendon injuries, oftentimes those are due to overuse, right? So continuous repetitive types of things that can put wear and tear on tendons and ligaments. And so that how we treat that is a little different than sometimes where, say, I'm treating folks that may have nerve pain due to degenerative causes, right? So wear and tear breakdown that's normal unfortunately, as we get a bit older and our bodies degenerate. So how we treat it, and that's really what's important when you see a doctor and you're getting evaluated. The goal is, asking some of those probing questions to understand how long has this been going on. Are there certain things that you're doing repetitively that may contribute to that? Because that will alter the plan of how things are done, right? And so from an athletic standpoint, oftentimes that can be modifying maybe how they're doing certain things, or maybe thinking about, some regenerative options. Again, the windows tend to be a little shorter. I need to get back to work, or I need to get back to playing, as opposed to, a lot of times in our setting with older patients, let's say, where they're not so much concerned about going back on the field, but they're concerned about playing with their grandkids and doing the day-to-day tasks. So it's really super important, to be able, when you're seeing somebody about this, pain, let's say in your body, to be able to kind of think back about, okay, what were some things that maybe led to this? Was there an injury? Was there trauma? Did I start a new exercise program? Did I just start running? Did I start playing pickleball a lot? I mean, these are things that we see a lot. It's, that folks start new activities and they're repetitive over and over again. And that may lead to, again, some of that, we call it kind of nociceptive type of pain, where it's tissue, muscle, ligament type of stuff.
Dr. Dumont joining us this morning from OrthoVirginia. You brought up pickleball. I want to dive into that a little bit. Have you seen an uptick in injuries because of pickleball? I see a fair amount. Yeah. I think for me, Jack, my kind of my mode of operation for most of my patients is I want people moving, right? Like that's the key, right? And sure, we're going to have maybe blips along the way where, pain may limit us, but my goal is, I want people, whether they're, an athlete, or if, they're going out and playing recreational pickleball, I want them to participate in those things. But to answer your question, yeah, I've seen a fair amount of folks. It's an engaging sport. I mean, I haven't gotten into myself. I've played a little bit here and there, but I can see why it would be a fun sport. It's, I think the community aspect of it is amazing. I love that. I mean, a lot of my patients that are participating in it, they've developed relationships, and that relationship piece is super important from an exercise standpoint. If you're doing things solo,
sometimes it's hard to keep going. So I love the fact that people are connecting with others, and it's a community, but there is, some casualties along the way where you start to do things over and over again, where it can be, you can start to see some overuse injuries.
So we were talking a little bit earlier, and you kept mentioning it's a shorter window for these professional athletes to try and get them better compared to if you or I maybe hurt something. We don't have to get back to 100% superhuman level abilities necessarily in 2, 3, 4 weeks or something along those lines. How is the pain management approach different for the athletes when you maybe are dealing with them compared to a regular person?
Yeah. Well, I think if we take a step back, one of the important things that I always try to get across early when I meet a patient is what are their goals, right? And so, when we look at healthcare is not just me telling somebody what they should do. It's a shared decision-making process, right? So, what's really important is to really clarify what are the goals and expectations, because I may have, I've had patients where I got a pickleball tournament I got in a couple of weeks. What can I do to get there? And so the conversation is, okay, we have to modify. So, I try to look at when everybody comes in and try to really gauge, all right, like what are we really trying to get accomplished here? Because we can, we may not be 100% pain free, and it may not be safe to do something, or it may be safe, but it may hurt, right? And so that's really where it comes, that whole decision-making process, and we have a shared decision-making process is really important for me. Okay. And that's kind of a big part of how I try to practice is, I try not to say, okay, just because they're an athlete, they get, treated this way, but universally, I mean, if participating in that pickleball tournament is important for you, it's important for me. So let's figure out how we can get you there, right? Safely, obviously.
Yeah, that's awesome. Dr. Dumont from OrthoVirginia joining us on this Wednesday morning. Where can listeners go schedule an appointment at OrthoVirginia with you all, find out which pain management options might be best for them?
Sure. Yeah, I mean, so, you can definitely go on OrthoVirginia.com. There's kind of a big section that'll give you an opportunity if you want to schedule. If you have my chart, you can schedule an appointment. If you would like to call our main call center, that number is 804-915-1910. You can also call and make an appointment that way as well. And so, probably the best thing though is just go online first. If you've been to OrthoVirginia and you have created that, my chart account, you can definitely get access and get an appointment with me or any of my other colleagues.
Awesome. Dr. Dumont, thank you so much for taking some time out of your morning to chat with us. We look forward to catching up again down the road, and have a great rest of your Wednesday.
All right. Appreciate you, Jack. Have a great day.
You as well.